Welcome to episode 7 of If Adoptive Mama Ain't Happy. Today I am going to talk to you about how to find therapy for your adopted child and your family. Being a child and family therapist myself, I found that adoptive families really could use support, strategies, and skills. So I'm going to help you figure out how to find a good one. So enjoy the episode. I'll see you there. Look, guys, therapy is utilized by 1/3 of adopted adolescents in the U.S. However, many adoptive families do not receive relief because their therapists have very little knowledge of adoption and how it affects children and families. Many issues are likely with adoption, including anxiety, grief, and depression. Now, if your child was adopted at birth, they may not have any of these until they reach adolescence, ages 10 to 9. Why is that? Well, adolescence is when a child truly understands what adoption means and how it contributes to their identity. This is when they may start asking more questions and you may notice behavior changes. If your child was previously in foster care or was ever abused or neglected, behavior issues probably start much earlier for them. It's so important to seek therapy for your adopted child and family because of the special and significant issues of adoptive families. These often result in the following mental health problems: anxiety and fear about rejection by their adoptive family, their biological family if they reach out to them, and peers who aren't adopted. Depression and grief about being adopted. Understanding why they were given away, so there may be feelings of not being good enough, grief about the loss of the biological family, sadness about not knowing their identity outside of being adopted, feeling different from the rest of the family, particularly if they are of another race or culture. Anger and aggression is an effort to test the limits of their adopted family's acceptance of them. Anger about not fitting in, not choosing to be adopted. There's also trauma. They've endured losses that are traumatic, being abused by previous caregivers, neglect, in utero trauma caused by maternal stress or the mom's substance use. Just being separated from the biological mother is traumatic. So how do you find therapists? Psychologytoday.com is a wonderful directory of therapists all over the country. You can plug in the issues your child and family are experiencing, insurance you use, area of town, types of therapy, gender, age, and religion of the therapist. Now that's in the States. If you're outside of the United States, it may be better to go to your insurance company's website and look for therapists that are in network with your plan. Now, some adoption agencies are contracted with therapists who specialize in adoption issues. Arms Wide Adoption Services in Houston, Texas offers free counseling to any and all adoptive families. In fact, I'm contracted with them. Churches offer counseling services too, and many of them are free or low cost. The Center for Adoption Support and Education, CASE, at adoption.org is a great resource for families. I actually received excellent training from them, so it's a good resource for therapists who want to learn more about adoption as well. So let's talk about the types of therapies that work well for adoptive families. Play therapy is excellent for ages 3 to 10. Let me talk a little bit about play therapy. So there are different types of play therapy, and I am so proud to say I just became a registered play therapist. What that means is that I have had extensive training in all different methods of play therapy. Now, you don't have to be a registered play therapist to use play therapy. So if you can't find a registered play therapist, just find an experienced person who uses play therapy effectively, and do make sure that they are not considering play therapy just playing Uno with your kid and encouraging them to talk. That's not the same as play therapy. So the kind of play therapy I use primarily with the youngest kids from maybe 3 to 6 or 7 is called non-directive or child-centered. Child-centered is its own thing, and I did get trained in level 1 of that. But basically, that's a type of therapy where the young child gets to decide what they play with and how they play with it. The therapist's job is to build a very trusting and safe relationship with that child so that the child can use the language of play. A young child is not able to identify and verbalize their feelings. So when they play, the therapist is picking up on their feelings, on their experiences, on patterns and themes that they see in the play that can indicate what's going on for that child. So I love child-centered or non-directive for young kids. Now, as children get a little bit older, they may not be as excited to play in the playroom, but you'd be surprised. I've had some 10-year-olds that loved the playroom, but it depends on the child. But if a child is not that interested in the play, I will do directive play therapy interventions. A lot of them may involve art, therapeutic games. I also have specific curriculums for different issues. So if I have a child that's processing their parents' divorce, we will do a curriculum about divorce where there's lots of games, activities, interventions specifically for divorce. But I also may work with grief, a grief curriculum. There's also specific games and activities for anxiety, for depression, for trauma. So there's just so much that a good play therapist can do with children ages 3 and up. Now, again, I use non-directive or child-centered for very young kids, but I use, the more directive interventions for the older kids. And these work with adolescents as well. So just because a child is a teenager doesn't mean they're not going to respond to the games and the activities. They can be very, very helpful. So I talked about play therapy. So now I want to tell you about trust-based relational intervention, or TBRI. This was a type of therapy developed by Karen Purvis. She has passed away, but her legacy remains very strong, as I am currently getting trained in TBRI. And this is an excellent intervention for children that have been adopted via foster care or have had trauma and abuse. It's all about attachment and validating the child's feelings, using a lot of regulating physical touch to connect with the child. I don't know a ton about it yet because I've only done the first part of the training, but I will share more as I learn more. TheraPlay is another type of therapy I am trained in. This is great for attachment as well. And what I do with TheraPlay is I model for the parent how to play with the child with really fun games, but there are different dimensions of TheraPlay. So there's structure, engagement, challenge, and nurture. So depending on what the child needs, I will do more or less activities from each dimension. So for example, if a child is oppositional and has a hard time listening and following instructions, I will use a lot of structure activities where I am leading the play and the child has to follow my directions. So I'm modeling this for several sessions for the parent, but then the parent gradually takes over and they lead the games and the activities. So I've found it very helpful with the relationship between parent and child in this type of therapy. There are also some great trauma therapies that are wonderful for adopted kids and their families. One of them is EMDR, which stands for Eye Movement Desensitization Reprocessing. It's a very fancy way of saying that it's based on eye movements and processing trauma in the brain and in the body. It's a very regimented training, and I am getting trained in EMDR soon. I am already trained in another kind of trauma therapy based on eye movements called brain spotting. I found that very effective with many of my clients. So it's similar to EMDR. Like I said, it's eye movements, but there's a pointer that the client looks at, and the pointer is moved as the eyes find a brain spot, a spot where they feel intensity in their emotions and their body, and that's where they can process whatever distressing memory or event has occurred. And they just, they don't have to verbalize anything. They can just sit there quietly as they process while the therapist just stays there to support them and checks in on them periodically. So I love brain spotting. Cognitive behavioral therapy is the most researched type of therapy, and there are play kinds of cognitive behavioral therapy as well as just standard for adults. And then there's also a kind of CBT or cognitive behavioral therapy called trauma focused. That is also shown to be really effective with adoptive families. Parent-child interaction therapy, or PCIT, is another great intervention which models parenting strategies for parents. I believe it's in the moment. I'm not trained in that. You may want to just Google PCIT to get more information on that. And then I always suggest family therapy if you have an adopted child, because siblings, their feelings matter. You parents, your feelings matter. And communication and understanding is so important for the whole family. So what I'm going to ask you to do now, since I've said my spiel, I just want to recommend that you don't stop with your adopted child's therapy. The whole family can benefit because, again, it's going to improve communication. It's going to improve the empathy that you have for each other. And, I think that it's important for everybody to have a voice because adoption affects everybody in the family. So finally, whether your family is in therapy or not, there are coaching programs out there like mine. I'm developing a 6-month membership for Christian adoptive mamas to get one-on-one strategies from me in a small online cohort with a vault of valuable resources. It will transform your relationship with your adopted child because you will understand them better, learn how to validate their feelings, and discipline them with love and endless support. Please join my email list, Facebook group, and download my free 7-day video devotional for busy adoptive mamas at www.faithful-futures.com. Again, that's www.faithful-futures.com. Thank you for answering the call to adopt. Jesus loves you, and so do I.